give everybody maybe one more. Okay, why don't we go ahead and begin? First, everybody, thanks so much for joining us today, and hope everybody's semester's off to the good start and that you and your family are healthy. And we wanted to have a session today to update folks on the beginning of the semester, our safe return to in-person classes on January 31st, and how the campus is operating. So thanks to everybody for joining us. Thanks to the folks that have submitted questions. Appreciate all of that so that we can have this time together. So as many of you, some of you have already been on campus, so some of you already know we're off to a fast beginning in terms of the semester. Our public health scholars have already been down into DC volunteering with Thrive DC every Wednesday to provide support services to people experiencing homelessness here in Washington, DC. And I think everybody knows that's a growing issue across the country, including in our city, and especially with the weather we've been having. So great work from our students engaging on that. Today, there was an announcement I hope everybody sees. JP Morgan Chase announced a $5 million grant. And that is where AU and several DC partners, including Trinity Washington University and Martha's Table, an organization that many of our students are familiar with, will launch an early education collaborative. And the goal is to increase access to education skills and training opportunities for Black and Latino women, especially in DC wards 7 and 8 for early learning. So that was today. And also in the last weeks, we've achieved a record number of applications for the first year class. And also we had a good strong finish in December to our campaign. So a lot already happening in this semester, and we're looking forward to a lot more change making as we go through this semester. Today we've got members of the whole cabinet. The whole team is here because we want to both listen and answer questions. And so I'm actually going to ask folks to introduce themselves. We'll go through that. As you can see from Cole in the chat, if you want to submit Q&A, we had a lot of folks submit Q&A. We'll work on those, and then we'll work on some that we're getting today. But first, why don't I introduce everybody and we introduce ourselves. Bronte, why don't we start with you?
Good afternoon, everyone. I'm Fantav, and I'm the Vice President for Undergraduate Enrollment, Campus Life, and Inclusive Excellence.
Thank you, Matt.
Good afternoon. I am Matt Bennett. I am the Chief Communications Officer.
Great. Bronte.
Bronte Burleigh Jones, Chief Finance Officer.
And I think this is Bronte's first of our community webinars. So welcome, Bronte. We're so glad you're here. Peter.
Peter Starr, Provost and Chief Academic Officer.
Billy Walker.
Hello, Billy Walker, Director of Athletics and Recreation.
Seth.
Hi, Seth Grossman, Vice President of People and External Affairs.
Trevina.
Good afternoon, Trevina Bird, Vice President, General Counsel, and Board Secretary.
Courtney.
Hi, everyone. Courtney Searles, Vice President for Development and Alumni Relations, and I'm working with a great team to lead the Change Can't Wait campaign.
Great, thank you, Courtney. Steve.
Good afternoon, Steve Munson, Chief Information Officer.
And Sarah. It's also, I think, Sarah's first community meeting too. Welcome,
yes, good
Sarah.
afternoon. Sarah Baldessaro, Chief of Staff.
Great, thanks team, and thanks for all of you all joining us today. And I'm just going to give a brief overview, and then Fanta, Peter, and Seth are all going to talk about specific areas like the COVID protocols, the academic approaches, and our workforce guidance. And then, as I mentioned, we're going to have time for questions. We're going to go over thanks to those who submitted early and those who are submitting now. I'm going to start maybe with something that I know has been a question for many, and it's something that I said when we made the December decision, but just want to repeat that we are returning fully to the face-to-face learning January 31st. That's this Monday. Said that in December when I just keep emphasizing it. It's a question I think people have had, but want to make sure we continue and make sure we are answering that question if that is one. In December, when we made the decision to do a short period of time online, we couldn't really predict the Omicron peak. Remember, this is December 29 when we do it. But what we did know is we could predict the disruption that was coming in January from both a health and an operational perspective. And from the outset, in terms of our decision making, I think everybody knows, and I'm sure you're tired of me repeating, but I think it always bears repeating, to go back to how the principles that we use for decision making as we're working through COVID. And number one is the health and safety of our community. Number two is excelling at our mission in terms of that mission of teaching and learning. And number three is contributing to the overall response in our region and more broadly. And those three principles led us to, and what we've tried to do is be very aggressive about our pursuit of our mission and do what it takes so that we can pursue our mission in the best way at every stage and every change in the pandemic. And it's why we had a mid-semester experience last year. It's why we were one of the first universities in the country to require vaccines, because we knew it was such an important part to getting our students back and face-to-face. It's why we kept mask wearing in place. And it's why we made sure that we had a face-to-face commencement in December in terms of, as you all know, that was backing up, and we did have Omicron at that point in time, but we went forward with our commencement, and over 5,000 people were able to enjoy and see their students, and the students participated in that. And we were moving and have been moving from a crisis mode to more standard operational mode as COVID continues to change and evolve, but just being in more of an operational mode. And, you know, thankfully, what we've seen is, I think we're seeing that we have hit the peak here in DC and around the country. That's starting to happen. Regionally, it's differing in different places. And we're starting to see some of that decline. And we're glad to be moving past that peak in DC, because in DC, we had the highest transmission rate in the country. We had numbers that we had never seen across the board, and whether that was cases, hospitalizations. And DC today is averaging about 761 cases per day and about 575 hospitalizations. So we're seeing the decline in cases. We're seeing that overhang of the hospitalizations, which occurs because those generally come a little later than the case reporting. And so we're confident that by the time we get to the 31st, we're going to be in a much better position. There'll still be cases, still be challenges, but we'll be in a much better position. And so today we want to talk a little bit about some of those operational things and how things are going to work. We've developed procedures in terms of our in-person classes and our services to operate at the highest level, even if we are still having cases, and whether that's students being absent or faculty being absent. We've got plans for our core services. We know those are essential parts of the student experience, whether that's dining, the library, campus safety, healthcare. All of those things are a part of what makes our students experience the whole experience, and are very critical things. So those are some of the plans we're going to talk about today. In DC, important for folks to know, we're still in a place where 10 days of isolation are required. We're continuing to work with the district. I know Fanta will talk a little bit about that in terms of we'd like to move to a different place with regard to that, both especially for our students, but also for our staff and faculty in terms of what that means for our operational functioning. So we want to make sure that you know where to go for information as things happen. That's a part of what we've been doing, is figuring out, making sure that that's in place. We'll talk about that today. We're striving for consistency when there are disruptions, so that there is consistency, that you know where to go, where to get information, and what to do if you, as a community member, whether you're a student, faculty, or staff, and you have COVID. So I want to turn things over to Fanta for an update on our COVID protocols. And then we will make sure we turn to Peter and Seth, and then Matt will walk us through some of the questions.
Good afternoon, everyone, again. Hope you're all well. So I'm going to just touch briefly on a couple of things, and then I'm sure there'll be follow-up questions. The first one having to do with testing, because many of you have asked questions about specifically the within 48 hours. For those of us who've been on campus since the start of the semester, even though we are remote and so forth, as soon as we stepped foot on campus, within 48 hours, we got our test. And we actually have thousands of folks who have actually done that already, because we have students who are in residence, we have people in the library, we have our facilities people, and the list goes on. And so what I wanted to make sure we all understood is, we're trying to have the baseline for where we are as a community as we begin the semester, understanding that we had a staggered approach. There were many folks who already began, coming to campus on January 3rd, and they were meeting the 48-hour timeline. For anyone else who has not yet done so, and you've been on campus already, we ask you to come and get your test immediately and as soon as possible. That is for our students and for everyone else. Anyone who decides this week to come to their office just to check in, decides to come pick up a book, decides to just come stroll on campus, please, after you've done so or before you do so, please go and get your test. We have the schedule for testing. We have increased testing hours until 6 p.m. And we also have been providing testing on Saturdays from 9 until 1 p.m. on main campus. And as we begin the semester, the law school will also be having hours that would be extended. And so we ask that everyone please go and get your testing done as soon as you can, and no later than 48 hours from the time you first step foot on campus. I've asked a question, I've gotten the question from lots of people saying, can I start that process now? The answer is yes. What we're trying to do is to get to as much of a baseline as we all get back to in-person, so we know where we are, and that will also help us know how to calibrate our mitigation strategies around our COVID response. So that's the testing. With that said, who is exempt from testing at this point? We have already messaged anyone who already was infected with COVID. If you had a COVID infection, you would pause for testing for 90 days. And there's about 800 plus people who fit that category who've received communication about the fact that they're on pause for testing. So we'll not expect those folks to do the 48 hours within the 48 hours. That's the only sort of exception to testing as we speak. In addition, for anyone who after the 48 hours, and you've met that 48-hour threshold for baseline, please go and get tested if you have any symptoms. Do not wait, go and get tested, even though you've met that baseline threshold. Make sure you go ahead and you get tested. We want to make sure, again, from the beginning, when there are any possibility of COVID transmission, that we try to stop that as early and as proactively as possible. And we're really relying on the community doing its part. And so I just want to reiterate that. You've gone, you've done your 48 hours, great. You've come back, you're negative, great. But at any point, if you're symptomatic, if you have any symptoms, don't try to guess, is it the flu? Is it the cold? Is it just a sore throat? What is, please go. We need to eliminate that as a possibility. And so that's the other advice around testing. We've also been asked questions around testing about ongoing testing. Will we have ongoing testing? Let me again remind folks, anyone who is unvaccinated will have to get tested twice a week, with no exceptions to that. So anyone who's had an approved exemption for testing will have to get tested twice a week. Anyone who would have been notified that they are a close contact by the COVID notification team will have to go and get tested. Anyone who's symptomatic will have to go and get tested. If in addition to those categories, we will also be looking at potential ongoing testing, the COVID response team will be looking at that, and we'll be coming back to you with what will be our provision for ongoing testing for segments of our community, and we'll be back to you with more specifics around that. And it's still under discussion, but we will be back to you as soon as possible. So that's the other piece around testing, and I just wanted to clarify that. Then the next thing has to do with isolation. Anyone who tests positive for COVID needs to isolate in place if you live off campus, whether you're faculty, staff, or student. You must not come to campus during that period of time. And as I was indicated before, the isolation period, unfortunately, to date is 10 days based on DC Department of Health guidelines. We're in active conversation with DC Department of Health to have those testing, those isolation timeline more in line with the CDC timeline. And we've been told as of this morning that recommendations are being put forth within DC Department of Health. And we're hoping that we're going to get a response by the end of this week. But until then, that is why you're getting the advisement from us that if you've tested positive, please isolate for 10 days. It's because of those guidelines from DC Department of Health, and that's the jurisdiction that has sort of oversight over DC schools, DC universities. So isolation, please. If you're COVID positive, isolate in place if you're off campus. If you're on-campus student, you'll be given specific directions for isolation that will be in a different location than where you reside. And again, between the COVID response team and our COVID notification team, that information will be provided similar to last semester. Lastly, contact tracing. We have to evolve our contact tracing protocols. Every single major city has massive challenges with the level of contact tracing that were being conducted during the earlier part of the COVID response. One, because the rate of transmission all around the country, and not just in the US, has been tremendous. And so with that, we too have to evolve our COVID contact tracing protocols. What does this mean for you all? We will continue to do contact tracing, but what it means is you will be receiving, as soon as you get the notification that you're positive, we'll be getting that information as well when you test on campus. If you're getting your test off campus and you know that you're positive, we ask you to self-report as soon as possible so that notification can also be forthcoming as a result of that. But once we get notified, you will be then, as a result of that, getting an email communication indicating what are the instructions for isolation, and you will be provided resources for how to do so. We will not be calling because of the volume all around, but you will be getting the email notification. And if people have questions, specific questions, then they can reach out to the COVID notification team. In addition, you will identify your close contacts. Your close contacts, therefore, will also be notified of the isolation period, and they too will have to follow the same guidelines and instructions on how to isolate. And we have all of this information that is available on the website, and we'll make sure at the end of the session, you know what those resources are, because we've just updated all of those guidance as it relates to contact tracing, as it relates to the health and safety guide for the spring is up and ready. Lastly, I want to talk about masking. We expect people when on campus to have either a KN95 or N95, highest protection mask, and we're requiring that people have that. If you have your own, wonderful. If you do not, we have central distribution points where you can pick up a KN95 mask from the university. You will just need to show your ID. And those distribution points that are central include the library, Mary Graydon Center, first floor, SIS, first floor. It also includes the Washington College of Law. We have also distribution points in Spring Valley Building, etc. And again, that is all available on the website, the list of locations, including hours of operations, and any member of the community is welcome to come by with an ID to pick up KN95 masks. And they're good for a period of time. And then when you need to get them replenished, you can do that, or you can have your own. So that's one of the expectations around masking. And it's incredibly important that masking is mandatory indoors. Outdoors, DC does not have that mandate, but we strongly urge people that if you're outdoors and you're in crowded areas outdoors, you should mask at all times for protection of self and other community members as well. And then events and visitors. Over this period of time of transitioning back as a community, we are asking that during this period of time for at least 2 weeks, with a few exceptions, that visitors, those who are not AU faculty, staff, and students, refrain from being on campus. The exceptions include, for example, if somebody is coming to teach a skills institute, that is mission critical. Of course, those folks would be allowed to be on campus because they'll consider adjunct faculty. Also, if admissions is doing some of their programs, those are some of the exceptions that have been granted as of now. But all other visitors are asked, really, with a few exceptions, to really refrain from being on campus for the first 2 weeks. And then we can start having visitors. And when visitors starts coming, they have to fulfill our requirement of being fully vaccinated. And if for whatever reason they're exempt from vaccination, they must show a PCR test within 72 hours. One of the things I did forget to say about the testing, we strongly prefer that you get tested on campus for the first baseline 48 hours, because we get that information and we can quickly respond with the COVID response for isolation if need be, etc. If for some reason you're not able to get tested on campus and you have to be tested off campus, we ask that it be a PCR. We do not want for baseline antigen testing. We want PCR testing, the gold standard for testing for the first baseline. And again, we are urging people to get tested on campus, but we also know that there are circumstances where people will not be able to do so. And if they have to get tested off campus, please let it be PCR. And then we're going to ask you for that baseline data to please fill out the self-reporting form where you're going to indicate your test and you will upload your test for the baseline reporting so that we can make sure we're having the information for all stakeholders within those 48 hours. Lastly, I will indicate as well, there's been a lot of questions of, can we start reserving rooms? We have our event scheduling protocols that is also up on the website, and we'll again have that as information that indicates how you reserve rooms, what are the protocols and your responsibility if you are hosting an internal event, your responsibility in terms of COVID response. And then lastly, there's been a lot of questions. Who's going to enforce masking? Who's going to enforce those? And my answer to that is this is a shared community responsibility. The idea that there will be folks who are patrolling at all times is simply not realistic. And so we need to get to the place where there really needs to be shared community responsibility for our health individually and collectively. And so the mantra, if you see something, say something to your colleagues and to your friends. If they're not masking, that's incredibly important for all of us to do our part, because we're now in a place where, as we move from the crisis response to an operational response, we do need to be at a place where as a community, we really understand the shared responsibility for the collective health. And so I'm going to stop there for now.
Thank you, Fonda, and thanks for all your teams have done on behalf of the university throughout this pandemic. I'm Peter Stein, Provost, Chief Academic Officer, and I'm going to talk a little bit about some of the specifically academic things that we are doing. As you can imagine, our students, faculty, and staff have expressed many different wishes about the spring semester: to come back fully to face-to-face instruction, to be fully remote for the semester, or in some instances to stay remote for an otherwise face-to-face class. In the interest of the best possible learning experience for all and to minimize disruption to student schedules, we're committed to maintaining the original modality of classes for which our students originally signed up. So face-to-face classes will stay face-to-face. Online classes will stay online. Also, in the interest of minimizing disruption, we're sticking to our published academic calendar, meaning, among other things, we are not moving spring break. And I will tell you that I have a daughter whose university moved spring break, and they were furious. The students, the parents were furious. We're not moving spring break. That said, to boost flexibility of options going forward, we have increased the number of online undergraduate classes beginning last fall, with a particular focus on gateway courses and courses in the AU core. This semester, for example, we are offering 174 purely online undergraduate courses, and that's something we were thinking of doing in the future as well. There are also a limited number of fully online courses available through the consortium of Washington universities. Because, and this is, if you take nothing away from what I said, this is really important, because their individual circumstances are radically different from one another. We've urged our students to work with their advisors to explore possible options to fit their unique circumstances, their majors, their courses of study, and so on. But we also ask everyone to be patient. Our advisors have borne a very heavy load throughout the pandemic and have continued to field scores of questions from anxious students and their families. So please be responsive and understand that if they don't get back to you immediately, that they have a very, very heavy load as a function of all that we've all been going through together. We know that, as Fonda mentioned, we know that over the course of the semester, a hopefully small number of our students and faculty are likely to need short-term flexibility around face-to-face classes, either because they're sick or in isolation, or in the case of students, some students, because they're subject to lockdowns that may temporarily preclude them from traveling back from their home countries. We've asked our faculty to brief their students up front, and you as students, I hope that you have been briefed on this, on how they will communicate with students if they, the faculty, need to isolate. Usually Canvas, maybe email, they'll tell you. Likewise, we've encouraged our students to work with their faculty and potentially with other students as course buddies to find ways to keep up with courses if they're sick or locked down country. And as always, of course, students are expected to make up the missed work at some point later in the semester. The Dean of Students Office will continue to inform faculty when a student cannot attend class for medical reasons. And as a reminder, faculty, as faculty should not ask students for medical documentation and should consider all medical absences as excused absences. To be clear, this guidance applies only to short-term absences, illness-related or due to temporary travel restrictions in courses designated as face-to-face for the spring 2022 semester. As I mentioned earlier, there's no option for individual faculty or students to continue an otherwise face-to-face class online for the entire semester. And finally, to piggyback on some of the things that Bronte was talking about, I'd like to call your attention to 2 changes to our classroom policies since last fall. Effective this coming Monday, faculty will be required to be fully masked while teaching, even if they were at a suitable distance from their students. And anyone needing to eat or drink in class should exit the classroom briefly in order to do so. If circumstances allow, we will revert to the somewhat more liberal policies of this past semester, allowing faculty to teach fully masked if they're at a suitable distance from students, and allowing students to briefly sip from a cup while still in class. But as the moment, we are asking everyone to be fully masked while teaching, and obviously while being a student, and also to exit the classroom if you need to drink during the course of a class. With that, I will pass it on to Seth Grossman.
Thanks, Peter. And it's good to be with everyone today. I'm going to talk a little bit about how our work modalities and related issues will work starting on Monday. Our work modality approach beginning on Monday should be familiar because it builds on the foundation we developed for the fall. As many of you know, in the months leading up to the start of this academic year, the university undertook a thorough analysis of the best way to approach our work, drawing on the lessons from our experience during the first period following the pandemic, best practice from other institutions, and extensive consultation with stakeholders at AU. Based on that effort, we concluded that the best approach for fulfilling our work in service of our missions was through a hybrid modality, where some of our workforce is in person all the time, and other parts of the workforce are in person part of the time and remote part of the time. We believe this is the best way, as I said, to fulfill our mission when it's safe to be in that modality. And as you heard from President Burwell and Vice President All, we are confident it is safe to return to in-person work with all of our health and safety measures that Fanta, Peter, and President Burwell described, including our vaccination requirement, testing, and the use of masks. So beginning on Monday, we're returning to the hybrid work modality that was in place for this fall semester before the December break. That means that staff will be returning to their schedule that was in place before the break. It also means that we are continuing the various components of our hybrid work modality, which goes beyond just the schedules, including the core days, which help us build community and enhance our teamwork. The core days were largely done remotely in the fall, and we expect that will continue during the spring. The approach to meetings that the university used in the fall will continue for now, where meetings were limited to small groups where people are comfortable in masks, and larger meetings were done remotely via Zoom or other tools. We understand and fully recognize and empathize with that some members of our community continue to face very serious challenges, particularly parents of young children, those in K-12 schools, and other caregivers. We know that for members of our community in these circumstances, issues can come up last minute that may interfere with your schedule. If you are in these circumstances and these issues come up, we encourage you and your supervisor to work together to see if there is room for flexibility in your schedule while still ensuring we are providing the critical services to the members of our community. For instance, it may be possible to shift your work to a different part of the day or a different part of the week without undue disruptions. We know, though, that this may not always be possible, given the nature of staff members' responsibilities, when the potential disruption occurs, or the length of the potential disruption. If it is not possible, there are other issues available to support you, including the Bright Horizons Emergency Backup Care and FMLA leave, among other tools. The key thing is that if issues come up, is for you to keep an open conversation with your supervisor so that we can all work together to support one another and and our service to our stakeholders as part of the delivery of our key services. We know that, as Peter said, and Fanta referenced, that things don't always go perfectly smoothly when we're in a period of transition, as we will be on Monday. We were very encouraged in the fall when we shifted to the hybrid modality of how people work together, gave people room and space to make adjustments, and we hope that that will continue on Monday. So with that, Sylvia, I will turn it back to you.
Seth, thank you. Peter, Fanta, thank you all. And we will go to questions now. Matt, I think you're going to help us with the questions we've received ahead of time and also the questions that we're receiving in the chat.
Yep, thank you very much, Sylvia.
Yeah,
absolutely. And thank you all for submitting in advance and in the Q&A. Please continue to do so as we go through this. As you can imagine, we've received a great number, both in advance and now. Please know that we review them all and make sure we get the information out as quickly as we can. We'll get through as many as we can today. And for those that we can't, please do check the website in the coming days for additional answers if we don't get to them today. And as you can imagine, many of the topics that we receive are similar, so we've grouped them together into some big categories. So it might not be the exact question you submitted, but it definitely is addressing all the points that we've heard. So first, Sylvia, let me come to you. You said very clearly we're coming back to face-to-face on Monday. Do you anticipate us having to shift to virtual learning again?
I don't anticipate that we will shift. And as far as that will go, I'll go ahead and say it is our plan right now to do our commencements face-to-face. I think everybody knows we did them face-to-face in December, and that is our plan. Is we're planning commencements now to give people a sense of where we're going and what our plans are. So no, I don't anticipate that we will have a change in terms of what we're doing right now and what we start on the 31st.
Great, thank you very much. Fanta, let me come to you. You covered much of this, but there's been a few additional questions. Just want to make sure people are clear on this. Can you do two things on testing? Number one, clarify for the 48-hour return to campus initial testing, does that have to be done on campus or can it be done elsewhere and reported? And second, can you just remind folks about how we are thinking about testing regimes going forward?
The 48 hours, it is strongly preferred that it be done on campus. However, for those who really are not able to do it on campus, probably because they're not here frequently and so forth, and it is a hardship to do it on campus, they're welcome to do it off campus, but it must be a PCR test. And then they need to fill out the self-reporting form. And in filling out the self-reporting form, they'll report that information and upload the PCR test information. And that's what we'll need for the baseline.
Great, thank you. And can you just remind folks about what you said in terms of looking at testing requirements going forward once we get further into the semester, the work you're doing there?
So one of the key testing requirements we talked about is, of course, unvaccinated. Testing requirement. We talked about testing requirement if you're exposed, testing requirements if you are symptomatic, and then we will be coming back with ongoing testing for different segments. And so that will be forthcoming. The when, how, and what will be forthcoming.
Great, thank you very much. Bronte, I'm going to come to you, give you your first question with this group. Can you talk about the status of the UPass program? We've gotten a lot of questions about that.
Certainly, Matt. Metro has identified a software issue with the UPass, which has caused some of our UPass holders to be UPasses to become deactivated. They are honoring all UPasses. So if you find that you have a deactivated card, you simply need to present it to the bus operator or the station manager, and they will honor it. We're asking that you not try to replace your UPass at this point. And for those students who were not here in the fall and are eligible for UPass, we still have them available, and you can pick those up.
Great, thank you very much, Bronte. Sylvia, I want to come back to you for our next question. Can you explain the decision for tuition, housing, and meal plans for not being discounted for the January period?
that decision was based on the fact that we have started our semester, we have started our academic calendar and are proceeding as planned in terms of both the classes that are going forward as well as the academic supports. So in terms of the tuition issue, that's why we've made that decision. With regard to room and board, I think as everyone knows, choices were made. We started everything on January 7th in terms of we are providing food, we are providing board, all of those things are occurring. And so the campus is fully operational in that way. So at this point, that is why we made the decisions that we've made with regard to that question about both tuition as well as the fees for room and board. And Fanta or Bronte, don't know if you all want to add anything to that.
All right, looks like they're both good. Thank you very much. Bronte, I'm actually going to come back to you for our next question. Can you talk a little bit about dining options? What will they look like on campus for next week? And are there any, or can students make any changes to meal plans?
No changes to meal plans. We'll be expected to execute our meal plans as arranged. All of our dining locations will be open beginning on Monday. We will have seating in TDR and in Subway, but we will be maintaining and monitoring our seating capacities. But all of our meal options will be available to students on Monday.
Great, thank you very much. Sylvia and Fanta, I'm going to come back to you for this one. Can you talk about why we are continuing the vaccine and booster requirements, particularly following the Supreme Court striking down the federal government's mandate for employers?
Sure. I think it comes back to something I said in my remarks earlier about aggressively pursuing our mission and pursuing it in the most excellent way we can. We are attempting to do that, and that's why we put the vaccine mandate in actually well before a federal mandate, and we were one of the first universities to do it because we believe that the vaccination and the boosters, and I saw that in the questions about the boosters are making a difference with regard to both prevention as well as severity of disease in terms of what the analytics are showing. And what we're trying to do is put in place the things that afford us the opportunity to make sure that we're doing everything we can to make sure that we're face-to-face, to make sure that we can do things like commencement, to make sure that we can do all the things that we think are priorities for our students and our community overall, whether that's the faculty, the staff, and the students. These are all the things that hit that health and safety and are a part of making sure we can do our mission in the most excellent way we can. And so we put this in place before because we believe it is the single, it is one of the most important tools. There are a set of tools that we can use, and the use of those tools evolve as the pandemic evolves. But this particular tool is a tool that is solid and has held, especially with regard to hospitalization and death, which are extremely important, as well as holding in terms of the booster helping with the ability to get it. Fanta, I don't know if you want to add to that.
The only other thing I would add is because we've received a lot of questions around this, and it has been around, if you've had COVID, do you still have to get the boosters? The answer is yes. As soon as you've recovered from COVID, we ask that you get your booster shots. And a reminder that our deadline for getting the booster shots in is February 10th. We encourage you to please upload your documents as soon as possible for the booster shots. But yes, anyone who's gotten COVID still has to get their booster shot once they've recovered.
And just emphasizing that point that Fanta just made, our daughter Helene did get it and tested positive December 23rd. And Helene has gotten her booster even following that because she became eligible for the booster in this period following. And obviously we're still, it's relatively close to when she had it, but we've gotten the booster as quickly as possible in terms of trying to make sure that she is safe for herself, but also how she operates in the community.
Great, thank you both. The next question is a broader piece of what we just talked about, and Fanta and Sylvia and Peter, Seth want to weigh in as well. We talked about, the decline in Omicron, and that's a good sign, but there are still, case counts and hospitalizations. What, in terms of how are we basing our decision? Why do we think it's safe to return to in-person classes and hybrid work next week?
So I'll start and the team can add. And it comes back to the question we just asked, which is we are putting in place the health and safety measures that are most important. And they're most important. One of the things I think we all have to do, and I think we didn't do a good job this as a nation early on, as the pandemic evolved, we knew that there would be changes and different information and changes in how we think about different things. One of the most important things that has changed with this current variant is what the variant does with regard to populations that are vaccinated, highly vaccinated and boosted, which our population is, in terms of issues of hospitalization as well as mortality. And so as one looks at the things, the case count as a measure is a measure that is a measure we understand, and but it is indicative of other things. And what we need to do is make sure we're watching some of these other elements as well. Some of these other elements are hospitalization. Some of these other elements are what are the mortality rates, because Omicron is more transmissible, more easily passed, but less dangerous, especially to the populations that are vaccinated. So why we believe it is safe is we have put in place, whether it's vaccinations, boosters, masking, and the masking conversation, the analytics that have so far, and again, these things evolve, we learn more things. But right now, the most up-to-date knowledge is that a mask that is firmly fitting, which is that duck shape. I know everybody says you look like a duck in the masks that we're doing, but that duck shape creates two things. It creates a bond to your face, but it also creates an ability for you to breathe a little easier versus the regular the 95s that originally came out. So it's easier to wear. It is tightly fitting, and it has to do with the material. In terms of that prevention and the transmissibility. As we know, and we're seeing those statistics about how Omicron stays in the upper nasal passages, that these things are all related in terms of this variant. And so we have put in place these pieces, and we believe that it is safe. And as we said, our principles hold: health and safety of our community, excellence in how we go against our mission, and our contributions in terms of how we think the community. Fanta, Peter, Seth, do you all want to add to that?
The only thing I will add to that, maybe because I'm in it every day, I want to be clear. It doesn't mean we're not going to get COVID cases. And I'm going to even go one step further. If you're comparing it to when we first started, it will be different, because this is a different place and space that we're in as we're dealing with Omicron. So we will be looking closely at case counts, but we will also be looking at severely ill, hospitalization, and those are going to be different indicators from when we first started. So I just wanted to sort of preface that, because this is what's been the national conversations as institutions have opened, as K through 12 have opened, and all sectors have looked at how they reopen. So I just wanted to preface that as well.
Thank you, Fanta. And I think our operational capabilities, that's the other thing that's different and has been impacted by Omicron, and we've seen it across the nation, whether that's the 2,600 flights, and I'm sorry for any of you who were on those flights, trying to move around the country around the holidays, or the fact that bus service here in DC has been limited, or the fact that, in both Virginia, DC, and Maryland, they put in place the emergency standings for the hospitals. And it's not, part of it is the fact that hospital healthcare staff have COVID and can't go. And so this operational capability is the other measure that we are watching closely, and part of why we wanted to make sure we're ready in terms of whether that's dining staff, whether that's the cleaning staff, whether that's our ability to have the library open. Those are a number of the considerations, as well as the health and safety, our ability to function.
Great, thank you very much. Peter, I'm going to come to you for a question about academics. Can you talk about academic support options that are available for students?
Sure, Matt. Academic supporting our students is the job of everyone here at American University. All our faculty, all our staff, this is what we do. On the specifically academic side, our students have a number of places to go. They're advisors, and be it the first year advisors for our first year students, but also the school-based advisors for our upper class students and for our graduate students are key folks to touch base with. Our Academic Support and Access Center does accommodations and disability related support, but it also does academic coaching, learning study skills. It does peer-to-peer tutoring. It does another variety of peer-to-peer tutoring called supplemental instruction, which is class-based rather than individual-based. And it hosts the Writing Center and the Math Stats Lab, tutoring lab. So the Academic Support and Access Center, if there's one word here, Matt, maybe the Academic Support and Access Center is it. But we also have TAs in classes and peer facilitators in certain classes like the AUX, the AU Experience classes, or have undergraduate peer facilitators. And then of course their faculty. Our faculty are, one of the things I discovered when I came to American University 13 years ago, is just how dedicated our faculty are to supporting and nurturing their students. And so whether the faculty are meeting students in office hours that are virtual or whether they're meeting them face-to-face, faculty are a major resource for supporting our students in the academic side of things.
Great, thank you, Peter. Fonte, I have two health and safety questions that we've gotten a couple of different variations of in the Q&A. The first one is about the KN95 mask and the N95 masks. First, will the KF94, the other version of that, be acceptable? Number one. And number two, can you just reiterate what you said the guidance is about wearing KF95s and N95s?
So regarding the KF94, I am not familiar with that, and I will need to take that back to the response team because I'm not as familiar with that. All of the literature and things I've read has been around the K95 in particular, and also, we said N9, the N95, but those are not comfortable to wear and really are worn only in certain circumstances. So I do not have an answer to the KF94. To the question of what's the expectations, you're expected to wear your mask that is well fitted. And in this case, the KN95 or the N95 at all times while you're on campus, in classes, in buildings, in public spaces, and all of that. The only time that you would not be expected to have those on is if you're a residential student in your room, your private room, or if you're a faculty or staff, if you're in your private office by yourself. Otherwise, at all other times while you're on campus, you're expected to be masked.
Great, thank you. And then the second question is about contact tracing and isolation. And a couple of different questions have been asked about if you are identified as a close contact, you yourself have not tested positive, but you are identified as a close contact, or someone in your household tests positive, are you supposed to isolate?
Sorry, Matt, if you're fully vaccinated, right? And especially if you're fully vaccinated and boosted, if you are deemed a close contact, you're not expected to isolate. What we're asking is that you get tested and that you monitor for a period of time, particularly for symptoms and other things, because that's when it could change. Because if you're having symptoms and so forth, you will want to get tested, and certainly if you test positive, then you'll have to isolate. But for fully vaccinated and especially vaccinated and boosted, you are not expected to isolate during that period of time, but we will expect you to get tested and to self-monitor during that period of time, and of course to continue to mask. That comes with it as well. If you're unvaccinated, that's a different issue, right? You will have to quarantine for that period of time.
Great, thank you. Billy, I'm actually going to come to you. We got a couple of questions about the fitness center. Can you tell people what the fitness center's operations are?
Yes, we will. Excuse me. We will be back operating at full speed with just community members to begin with. You just have to be able to have proof of vaccination and booster now. Great,
thank you. Peter, I'm going to come back to you as we get close to the top of the hour here. Could you there's been a couple of questions about clarifications around two different things. So if you could just reiterate the requirements around eating and drinking in the classroom, number one. And number two, the guidance to faculty for when they may test positive and how they manage their class in that situation.
So let me start with the second. When faculty test positive, we are telling faculty that they may be absent for 1 or 2 class meetings. They should immediately contact their department or their school, let them know that they're going to be absent, try to make arrangements to cover the class. One of the nice things about Omicron when you're fully vaccinated and boosted is often you can still teach the class, but from a distance. Notify your students immediately if there are changes in meetings, because you have to self-isolate because you've tested positive. And work with the school, work with your department in order to make sure that your classes are covered and that our students have appropriate work to take them forward for the time being. We are very much encouraging faculty like students to have course buddies. So someone in one field who knows that if they were to be absent, whom they would ask to cover their class, and vice versa, so that you create arrangements so that the classes can be covered and everything, the learning can continue as before. As for eating and drinking, Matt, in the fall, just to give you context, in the fall we allowed students to raise their mask, take a sip, and then lower their mask. Because of the contagious nature of Omicron, we are asking students in that case to go briefly outside of the classroom. They're asking faculty to understand why students may be doing that and to come back as soon as they're finished so that there's no lifting of masks for the foreseeable future. Obviously, there's a very small number of members of our community who may have accommodations around eating and drinking. They should go to the Academic Support and Access Center and work with the professionals there in the Academic Support and Access Center around specific accommodations.
Great, thank you. Since we are coming to the top of the hour and we know we've gotten many more questions than we could possibly get to, we will continue to answer them the best we can throughout all the materials on the website. So do encourage you to continue checking the COVID resources page and all the other resources that are available. And with that, Sylvia, let me turn it back to you to wrap us up.
Great. Thanks, Matt. Thank you. And thank you all, the team, for joining us for these questions. And thanks to the community for your engagement throughout all of COVID. One of the things that I think you know that we have tried to emphasize and live is the importance of us as a community, and that we've tried to work in terms of making sure that there are opportunities for us to, I know it isn't a conversation as we always knew it, but to have the conversation, to hear the questions. The questions reflect the concerns that we have, but to come together as a community. And I think our fall semester was an incredible example of that. For the most part, it was I hope people feel it was a very successful fall in terms of what we were able to do and how we were able to move forward with our core mission in so many important ways. And whether that was our students' incredible presence and the things that they were doing and achieving both inside the classroom and outside the classroom, to the work that our faculty was doing, our largest grant that we had ever gotten as an externally funded grant as a university from the National Science Foundation, to the engagement of our staff. Our incredible staff in supporting and having us be able to have the kind of semester, including things like the commencement, that many people, I think, you know, brought down their commencements, but we moved forward. And so I'm excited and hopeful that we can continue on that path as a community of care. That is so much a part of this and so much a part of, and you heard that I think a lot in Fanta's answers in terms of how we think about making sure that we are considering and thinking and taking care of ourselves and each other as a community. And I think that approach and what we've had to do in COVID is making us stronger and better as we continue to move on our mission and what we're doing, and whether that is, each of us as individuals, but us as a collective group of change makers. So thanks to everybody for joining us today. Your interest and your time and engagement is, to me, a reflection of that community of care. So looking forward to seeing everybody. I see a number of our students I get to see. I've been on campus during this period of time and have seen you all and here, and we're going to see even more more, and looking forward to seeing the whole community and really getting this semester. We're already going, as you can hear, a roaring start already in terms of what's happening, and a lot more to come. And hopefully a lot more enjoyment of that as we get this semester moving. So thanks, everybody.